I don't know if you realize this, but March is Endometriosis Awareness Month. It is something that is very difficult to diagnose, and Dr. Narula is back with a story of one woman who her journey to a diagnosis took years.
I know. Can you believe that? Well, you're about to hear. So Melissa Diamond knew something was wrong from the time she was 12 years old, but it took 2 decades and countless doctors before she got a diagnosis. Take a look. It took Melissa Diamond 20 years to get a diagnosis of a disease that affects millions of women, endometriosis.
I always knew that something was wrong.
The intense pain came early with her first period at age 12.
It was the most excruciating pain that I've had in my entire life. I knew that periods can be bad, but I was missing school every single time I got my period.
Endometriosis results when the type of tissue that forms the lining of the uterus grows in places it doesn't belong, commonly causing pelvic pain, heavy periods, and fertility issues. It affects 1 in 10 women, may disrupt daily life, and requires surgery to diagnose.
I was on the pill for 16 years, and so that just seemed to be the norm, I guess.
Birth control cut most of Melissa's pain, but she says it came roaring back when she stopped the pill.
I was told I have IBS, and then I was told that I just have heavy periods. And I tried acupuncture, I tried everything. I went to doctors, I asked them what was wrong with me. And they just said, you should go back on the pill. I never had anyone try to connect the dots for me, which was the most frustrating part because they all seemed to be linked together.
Last year, an emergency room doctor suggested her pain may be due to endometriosis. And after finding a specialist in the disease, a surgery confirmed the diagnosis.
He found endometriosis on a ton of my organs. It was on my pelvic lining, my intestines, my bladder. They removed 23 lesions in my body. And they found lesions that were 20 years old. And so it was always there.
Melissa says doctors need to be taught more about endometriosis in medical school, encouraging women in pain to speak up, even after they've been dismissed.
I feel like women don't know necessarily how to advocate for themselves when the person that they're supposed to trust, like a doctor, is telling them nothing is wrong. Thank God I kept pursuing this. But it makes you feel like you don't matter.
And Melissa's experience is far from rare. More than 75% of patients are misdiagnosed with other conditions, and on average, it takes 4 to 11 years just to get a diagnosis.
On this couch, you've had a lot of questions during that segment right now. Why? Why does it take so long? And if you're someone at home right now and you have unexplained pain, what do you say to them?
Yeah, I mean, I think we were all surprised to hear, right, the amount of women this affects, 1 in 10 women. And the problem is that the symptoms can be very diverse. So you can have, as you heard, pelvic pain, abdominal pain, fatigue, urinary symptoms, painful periods, all kinds of symptoms. And so it can be hard, as you heard, to connect the dots.
Right.
Some women may be asymptomatic, and some women may discover when they try to get pregnant that they have fertility issues, and that's the time where it's picked up. The other issue is that there's no blood tests, there's no real imaging tests, so it requires a surgical laparoscopy procedure to really make the diagnosis. I think that many women, as you heard, go undiagnosed, they go misdiagnosed, they get told they have irritable bowel syndrome, they have mental health issues, or they just aren't believed. So if you're someone who thinks you might have endometriosis, you want to keep a chart or a document or a journal of your symptoms, when they're happening, what they feel like, where they are. There are apps actually now you can go online and potentially download that can actually help you chart out your symptoms, and you can show that to your doctor. And sometimes that helps them put together the dots. There are also organizations like EndoFound, advocacy groups that can help educate women. And we've recently seen a lot of celebrities come out to increase awareness. So Padma Lakshmi, Lena Dunham, Halsey, even our own Whoopi Goldberg. So hopefully more women don't have to suffer with this condition.
Oh, I know what you mean, because it's something, you know when something's not right.
You know.
You just know.
You have to advocate, as we've talked about so many times on this show. You have to get a second opinion. There are endometriosis specialists to seek out if you're not heard.
All right, Dr. Narula, thank you very much.